Hi, my name is Jessica Kidd, and for this speech, I chose to do the topic of end-of-life care, the ways to meet the patient's best wishes, and the different options that you have for end-of-life care. This topic really hits home for me because I lost my father a few months back to brain cancer, and I had no idea about end-of-life care until then. And it kind of interests me, and I think it's something that people should talk about more. So that's actually leading into my first point, which is the taboo of having the talk. When you go to the doctor and get a physical, you don't really go over end-of-life care. There's so many things that people don't know that they even have to make decisions about until it's too late. And I think that it's something everyone should feel comfortable talking about. I actually found an interesting fact. It said that 93% of people want end-of-life care to be talked about at the doctor's office and made something that's easy to talk about instead of such a taboo. Yet nobody wants to have the conversation because, let's be honest, nobody wants to talk about possibly dying. So I think that that would be a big help if we add that to a checklist for each doctor's appointment whenever you maybe first sign up for the doctor's office or have your yearly physical. Just at the end, have a small 5-minute talk about what your wishes would be, because most people don't know. So the second point that I wanted to talk about is probably the most important, and that's all the different options you have for end-of-life care. So the first, obviously, is you can choose to end your or live out the rest of your life at home. There is at-home health care, nurses that can come out around the clock, and that kind of leads into Haven Hospice. So they send out nurses to your home. They can provide hospital beds, pain management through giving medications and everything. And you don't really have to be hooked up to a ton of machines. You're not in a hospital, so it doesn't restrict any family members or friends coming in and visiting with the patients and family, because that's the time you want friends and family around the most. They also provide spiritual help, so if you're religious, they have pastors that come in, they have therapists, and you really have more of a mobility towards the end of your life. If you want to be at home, they can make it happen. And they come in round the clock, so they make sure that you stay comfortable, but you can still be alert and know that your family is there, and they make you feel more comfortable. You can also go to Haven Hospice or other companies that do things like Haven Hospice. Usually it doesn't really cost money for patients to go into Haven because it's not meant for them really to get better. It's just to keep them comfortable. And it's a great place to be. I mean, like I said, I experienced it with my own family, with my dad, and I practically lived there for over a week. And they made it very comfortable for everyone, and they helped me through the process. I think it was a wonderful thing to have them, and without that, we wouldn't have made it as far as we did. And they kept my dad comfortable, and we were allowed to have as many visitors around the clock as we wanted. Another option is obviously to be in the hospital. When you're in the hospital, you get woken up at all hours of the night. You're limited on visitors, and you're always hooked up to monitors, loud, that go off all the time. So you're not very comfortable, and nobody likes to be in the hospital. So I think also my last point is get all of your affairs in order. Advance directives are very important because that's the only thing that lets everyone know what your last wishes are. If you want to be revived, if you want to stop all medication, that's the only way to let people know if you're unconscious what your last wishes would be. Also, power of attorney, that gives whoever you're closest to, family member, friend, the power to let the doctors know if you want to continue on a medicine or if you want to go ahead and let nature take its course. And I think that that's very important to have that conversation with your family, to let them know how you really feel and what your wishes are. Because we all want everyone to be happy and get what they would want. So thank you.